Hey guys, welcome to Thrive Bites podcast. I'm your host, Dr. Colin Zhu, and thank you so much for listening on. You could have been anywhere in the world and you decided to spend just a few moments of your precious time, and we greatly appreciate it. Here on the podcast, we talk about three things: living a plant-powered lifestyle, enhancing emotional resilience, and creating a thriving mindset. And I interview a range of passionate guests such as physicians, dietitians, coaches, entrepreneurs, and many more. And please join me as I deliver these engaging, informative, and high-valued conversations for you. And just remember, the first 5 seasons of the Thrive Bites podcast can now be found in the Chef Doc app, available in your Apple Store and Google Play stores. So what are you waiting for? Come on inside. Hey guys, if you enjoy this, don't forget to check back to our part 1. So I think that we kind of, segued a little bit or digressed a little bit. But, my original question that I was going to ask you was, why do you think it's important for healthcare providers as well as the public to understand how money is spent through the Farm Bill? Is there anything else that you would add as an answer to that before we move on to the next question?
Sure. So I do think we've brought up a fair number of points thus far about why people should care. I mean, any American should care because any amount of money our government spends, well, those are our taxpayer dollars, And so we want to make sure that our dollars are used in good, responsible way. We are all voters. And so, we can be aware of who we're voting for and what they're supporting in terms of agriculture and food production, whether it's the Farm Bill or other pieces of agricultural legislation or even, healthcare. I know we're not talking about healthcare policy as much today, but so being an informed voter, I think that's why we should all care. And then as a healthcare provider, we talked a little bit about even topics related to pesticide exposure and understanding what we're grown and where the food is coming from. Well, we can make informed recommendations to our patients. Once we get to know our patients, whether in groups or individuals, to know where are they buying food and what do they have access to? Maybe are they eligible for certain benefit programs to help stretch their dollars a little farther? Can you even is it appropriate to include recommendations for your patients to try to prioritize domestic, when they go to the big grocery store? Better yet, like you mentioned, the farmers market, if they have access to one, can they shop there? Can they keep their food dollars as local as possible to help keep farmers in business? And so I think the way that we make recommendations, those can be influenced by this knowledge. We're also all consumers, so the way we're spending our dollars when we're healthcare providers, a lot of people look to us as an example, as a model. And so, if we're hosting people for dinner or in our community and people see what we're eating and the way we're spending our dollars, well, we can set a good example. So I think all sorts of reasons why it's important for us to know.
So much. Next question. In terms of the current status of the Farm Bill, I believe that, we are in a new cycle. And so my question is that what are some of the changes that were made in this current Farm Bill, and how should we expect the next version? How should we expect in the next version of the Farm Bill to anticipate?
Yeah, so the Farm Bill that's currently in place, I mentioned before, was signed into law in 2018. It had a 5-year life. So actually, we've already extended it 1 year because Congress did not draft and finalize a Farm Bill last year. So we are currently looking at an expiration of the current Farm Bill in September. And at this point in time, I haven't checked the news today, but as of, I believe, late last night, we had not seen, so we've only seen one draft. So to reauthorize a Farm Bill, both the Senate and the House Agriculture Committees need to draft a version. And then eventually those versions will be consolidated. Once enough people agree, it will be sent to the White House for the president to sign. So at this point in time, we've seen a framework or sort of like an outline from both the House and the Senate, but we've only seen one full draft. The current Farm Bill, as I mentioned, it's going to expire now in less than 2 months. And Congress takes recess in the summer. And we're looking at an election season. Most people at this point would say it's pretty much near impossible that we will have a new Farm Bill signed into law this September. So it's really to be determined whether we will extend it one more year, whether multiple months might pass, and then perhaps something will be put into place and signed early in the new year. But a lot will also depend on, what the outcomes of the election in November and who's in majority in Congress, who's in the White House in terms of signing what's already been proposed. So there's so many factors up in the air right now. And I'll make one more point and then I'll answer your specific question about sort of what changed last time. There are a lot of groups, advocacy groups, many of which I'm really aligned with and supportive of, that are really advocating for signing a farm bill into law as soon as possible. Like, we can't let it expire. This is so important. We need to keep providing these supports, whether it's nutrition assistance to low-income families, subsidies to farmers, whatever. We can't let the farm.
Meaning like funds will go out, or is that what they mean?
So essentially, yes. Now, we don't have time today to dig into it, but it's actually quite complicated. Different programs sort of expire and lapse in a different way. So like SNAP, for example, is not going to stop immediately when the Farm Bill expires. Like, it will go on for quite some time. There are a few other programs. Like, I think there's like an organic transition cost sharing program. That one is a little bit more at risk, but the fate of each program will differ if the Farm Bill expires. That's what I'll say. I wanted to make sort of the general point, though, that when a lot of groups, probably even some healthcare providers included in that, say we need to sign a new Farm Bill into law as soon as possible, we can't let it lapse. I do think it's important to keep in mind that, we don't necessarily want the Farm Bill to lapse, but we shouldn't be in too much of a hurry to maintain the status quo, because kind of based on a lot of what we're talking about today, the status quo isn't so great. There are a lot of problems with the way we're spending our Farm Bill dollars and what we're producing in this country, or what we're not producing. And so, yes, it is important to come up with a new Farm Bill and sign it into law soon, but we don't necessarily want to just maintain the status quo. We want to make sure we're moving in the right direction. And so, to answer the second part of your question, in the last Farm Bill, there were some positive changes in terms of a few new programs and programs that were made permanent. Permanent means they'll be included in every subsequent Farm Bill, looking at support for marketing and sort of business operations for small local producers, sort of helping them to stay in business, training and outreach for some of the beginning and veteran farmers, like we talked about. So it is good. There is some increased emphasis on that. Probably not nearly as much as we need, but we're seeing a little bit of that. In the last couple of Farm Bills, we've seen creation of nutrition incentives in the Farm Bill. And I know we won't have much time to talk about food as medicine today, but I'm sure you've had other podcasts digging into food as medicine. So one exciting change in 2018 was we saw the very first produce prescription program built into the Farm Bill as part of the GusNIP program, which is the primary nutrition incentive program in the Farm Bill. So it's really the first connection we've ever seen between healthcare and Farm Bill dollars. It was a pot of money for pilot programs that have now been operating for about 5 years around the country, healthcare providers. I believe at this point, it's just physicians, although that may be expanded to include dietitians and others moving forward, to write prescriptions for healthy foods that would be paid for essentially through Farm Bill dollars. So it's not meant to replace, initiatives that are already happening through nonprofits, maybe even reimbursed through health insurance. Those are great, but it's an additional mechanism to enhance access and create a new model. And so I think that was an exciting change. There were some maybe not so great changes. I'll just call out one and then we can move on. That there was an expanded definition of who's eligible to receive subsidy dollars, kind of jokingly called the 23andMe rule. So distant family members who are not directly engaged in farming are now considered eligible to receive the subsidy dollars. So sort of a mixed bag, I'd say.
Yeah. Going back to the food prescriptions, and especially for some of our audience that are healthcare providers, for that program, will it continue to exist? Do you anticipate that to continue to exist through the new one, you would say? Or do you think it's going to expire if a new Farm Bill signs into law?
Yeah. So the pot of money, I believe it was $25 million for prescriptions under the GusNIP program umbrella, were considered a pilot in 2018. And so as part of that pilot, there is a mandatory evaluation, which is great. I think probably most people on this call are firm believers that research and evaluation is important to understand what's working, how to scale up, how to modify, et cetera. We have seen some preliminary information coming out of the evaluations looking at impacts on, well, I guess just for starters, kind of like redemption rates and things like that, but also impacts on food security, impacts on consumption of fruits and vegetables, things like that, even like usability and satisfaction. What I don't believe we have yet seen, which I feel like is sort of the holy grail when we talk about these sorts of food as medicine interventions, is what about health outcomes? Have we actually seen improvements in health outcomes? Mm-hmm. Gosh, even reductions in healthcare costs or prescriptions or whatever it might be. So we don't yet have those data. Last I heard, I was on a webinar a couple months ago. There's a sort of structure that was created under the Farm Bill as well to provide technical assistance for the evaluation for these pilot programs. So last I heard, they have collected and are analyzing data looking at health outcomes, because all of these pilot programs involve the physician prescriptions. They're being documented, and there's sort of multi-stakeholder pilots. And so I do believe payers are often involved. Like, I know of a pilot happening here in Washington, D.C., where at least one of our local Medicaid plans is involved. And so you have like claims data, you have a lot of data, and it just requires complex, time-consuming analytics. So I believe there are analyses in the works to try to get some understanding of health outcomes, but we don't have them yet. Yeah. All that to say, I believe that we will at least see the same level of funding under the next Farm Bill. I would hope that we will see these data soon that will provide motivation for at least modification, if not, enhancement and scaling up of these programs so that they're even more broadly available, that it's no longer considered a pilot. But I think a lot of that will depend on what do the data show about how effective these programs are. So I think some of that still remains to be seen. And I think that probably sounds familiar to you and your audience when we think about food as medicine. We've all been so excited to see the growth of these interventions in recent years, but to actually look at data based on concrete, like RCTs or something, well, there aren't really data to show long-term changes or improvements in health. Most of what we know are based on sort of models and prediction at this point.
Yeah. No, I mean, it's very exciting to hear that kind of pilot going, especially in the realm of food prescriptions. And, we definitely would continue to follow in terms of how that will change over time. The next question I have is, what can we take away from our current latest Farm Bill that helps to kind of strengthen those dots of food, farming, and health? Is there something that we can take away from our viewpoints that say, okay, are we continuing to bridge this, the gap of connecting these dots? Or is there something that needs to change for the next one in order to, make that happen? Essentially, are we headed in the right direction?
So let's see. There are a lot of ways of answering this question. One way that comes to mind, so every roughly 5 years in the US, we conduct what's called the Census of Agriculture. And that's the main source of information, publicly available information about farmers in this country and what they're producing and who's receiving what subsidies, and just an enormous amount of this type of information, and published by USDA. We just saw the most recent census. And so I think when I was in your meeting a couple of months ago, I shared some of this latest information that, we've seen a couple of small points of progress. Overall, unfortunately, we've seen some not so great trends continue. So for example, this trend of sort of consolidation, big farms getting bigger, fewer farms. We have fewer farms in this country. So those are continuing to get worse. We're seeing more consolidation.
Like healthcare systems.
Again, another great parallel. Absolutely. I don't remember the statistics off of the top of my head, but something else I've spoken about a little bit, and I know we don't have time to dig in today, is also looking at disparities when we look at which groups of farmers, whether it's like by racial, ethnic group or geographic, whatever, are receiving the most subsidy dollars, who own the most farmland. As you could probably guess, we see some major disparities in that. And I do think we've seen a little bit of improvement in this country, but we still have enormous gaps to close there. I think one small positive that we did see in this latest census is that we do have a small uptick in the proportion of young people entering farming in this country. There can be many factors contributing to that. We would hope that some of these new programs in the Farm Bill, like the technical assistance, the training for these specific groups of farmers, whether it's veteran, young farmers, quote, disadvantaged farmers, one would hope those programs are driving it. When we look at factors related to like dietary quality and others, I don't think we're seeing a lot of improvement. I don't remember the exact article. I do feel like I saw a publication in the last month or two looking at maybe based on the healthy eating index or something like what does dietary quality look like in the United States today? And I do feel like there were a couple of areas where we did see some improvement. It wasn't just all doom and gloom, but I'd say given the enormous amount of effort and money and time that we as providers and our government and others are putting into improving dietary quality, I think we should expect to see much more positive impact. And so there are obviously still impediments. And I think a lot of the sort of subsidy structures and other programmatic factors we're talking about today are kind of getting in the way. And so, and part of your question, I think, was sort of what can we carry forward? Well, we talked a little bit about nutrition incentives and produce prescriptions. And we're really hoping that we'll find some good outcomes of the programs that are already included, and maybe those will be able to scale up. I do think there's obviously still room for improvement around like what foods we're subsidizing, what types of production systems we're subsidizing, and sort of closing some of those discrepancies again between what we're supporting on the one hand and what we're recommending people eat on the other. But I do think there are some good lessons. And for now, I do also think the more healthcare providers, the more people on the call or people in ACLM, whoever it is, are learning, I think we can all make a positive impact at the individual patient level, what we're recommending, and at a broader level. So each day that passes, it's just more time for us to learn and make a positive impact.
I love it. I love it. That's a beautiful segue into my next question for you. If I gave you a magic wand and you have the ability to affect any component of the Farm Bill, what would you change and modify that can really benefit as many consumers, the average consumers, as much as possible? I guess in the lens of health, right? Because, you started off as a dietitian and, kind of, dipping your toes in clinical and then working on policy and all the consulting and everything in between. Where do you feel, if I gave you a magic wand, what would you do on, from your vantage point, having been able to see so many different angles, give us the most effective change?
Yeah, I think that there are many aspects that I would say need to change. I did hear you asking that question, I guess, like sort of how do we help the most people, the largest proportion? And so when we think about where the most dollars are spent, I mentioned before 85 or more percent are spent on the nutrition title. And there are certainly a lot of Americans who are receiving SNAP benefit. I don't remember the proportion off the top of my head, but somewhere around 1 in 7, between 1 in 10 and 1 in 7 would be my guess based on the prevalence of food insecurity in the country. But if we think about the largest impact and even thinking kind of more upstream, because also SNAP is not necessarily kind of an upstream driver. It is important, and I don't mean to belittle it or the other nutrition assistance programs, but if we think about what people are growing and what foods are available in the store and how much they cost, these sort of subsidy structures, which, we didn't really get into nuances in this call, and I'm not sure how much it matters for listeners, but the largest way in which we're subsidizing commodity production in the last maybe decade or so is actually through crop insurance subsidies. So we've sort of shifted the way we subsidize agriculture over time. It used to be more like direct commodity payments. Now it's more through this beast of crop insurance. But we know that most of these payments are going to the largest farmers. There's actually not currently an income limit for recipients of crop insurance subsidies. So you could be the wealthiest farmer in this country and still be eligible to receive taxpayer funded subsidies for your crop insurance premiums. And so, there are obviously nuances into how these programs are written, many hundreds of pages, and we don't need to dig into that today. But
No.
sort of a general way of answering your question is reorienting the way that we're subsidizing agricultural production so that we're not continuing to fuel or help build a safety net for the largest producers of commodity crops to produce more and more, get bigger and bigger. And that, just relatively speaking, makes it harder and harder for the producers of the fruits and the vegetables and the nuts and legumes and the smaller producers and the younger producers. It just makes it, relatively speaking, so hard for them to stay in business and make a living, and then to be able to afford healthy food for their families and help keep them healthy. So we need to, also keep in mind that our farmers need to have a good livelihood and to be able to afford to keep themselves in good health as well.
Yeah, so many great points today, and it's just so many things to tackle. Obviously not enough in this call, but thank you so much for eloquently packing that plate of spaghetti, going from a cooked plate of spaghetti back to its original packaging where you can actually see they stand up and you're like, oh, okay, I could actually take a strand and have that, okay, that's that title and that concept and this, and, so you did a beautiful job, and I really thank you. And I'm, know that the listeners really appreciate it. Let me show them your book. Can you tell the audience where we can get your book?
Oh, awesome. Thank you. Yes. So one place is on my publisher's website. So my publisher is called Island Press. They produce publish a lot of books around different environmental issues, including many in food systems issues. Island Press's website is one. It should also be available from all major retailers, Barnes & Noble, et cetera, online as well as in stores. There are a lot of different places to buy it. I know probably where these days maybe most Americans are buying books, but to whatever extent people are also able to go to bookstores and help maybe even keep their local book retailers in business, I think those are great options as well. But it should be pretty widely available.
Awesome. Well, we really appreciate the work that you're doing. I think it's not an easy task to be able to. I think it's wonderful that the path that you've traversed, and I know how it can come with its own challenges. But going back to my initial questions to you is, has the path been satisfying and meaningful and impactful? Because part of what we care about on this podcast is making sure that, yes, we can all have our passions, but at the same time, have those passions give back to us, right? And that fuels our fire to keep going. So I could see that in terms of how passionate you've been eloquently able to, disseminate the information for so many different times and so many different venues and formats. So I really appreciate your time for today.
Oh, I really appreciate those comments, Colin. And thank you so much for our conversation today, too. I really appreciated talking with you, and I'm excited for people to be able to listen in. And people have any more questions or are really excited and want to learn more, maybe there are ways we can even work together. I would love to be in touch with any of your listeners.
Awesome. And we'll definitely put your website, if that's okay with you, Absolutely, on the show notes when this airs. So thank you again so much, Christina. Guys, if you enjoyed this, please like, share, and subscribe. And if you feel like this was a benefit for someone else, please let them know. And until next time, please say goodbye to Christina. Bye-bye.
Bye-bye. Thank you.
Hey guys, we hope you enjoy that episode. If you like that, please like, comment, and subscribe. And please follow us on Apple Podcasts, Spotify Podcasts, and anywhere that you listen to your podcasts. And if you felt that this was a benefit for someone else, please let them know. And also remember that the first 5 seasons, 150 episodes, now can be seen and heard on our new The Chef Doc app. And don't forget to give us a 5-star rating, and we greatly appreciate it. And we'll see you on the next one.